Aceclofenac. For aceclofenac, the dose is 100 mg, right? There's also one mode which comes in like 200 mg tablet, and maximum you can give like 2 tablets for 100 mg and 1 tablet for 200 mg, which makes up the maximum dose of 200 milligram per day. And if you go beyond that risk, if you go beyond 100 milligrams, there will be a higher risk, right? If you go beyond 200 mg per day. And for the aceclofenac, max dose is 200 mg per day. Right, so this was all about the GI risk. Now, talking about the onset of action. The onset of action for the aceclofenac is similar to that of others. It is about 30 minutes to 1 hour. Next is peak timing. Peak timing is 1.5 to 3 hours. And total duration of action. Duration of action is 8 to 12 hours. So this is one of the key players over here because it lasts for a longer period of time as compared to that of the diclofenac. Diclofenac is 6 to 8 hours and aceclofenac 8 to 12 hours. So overall it's much better. Right? There's also another feature which makes aceclofenac much better than the diclofenac. Though the side effects of diclofenac and aceclofenac is almost similar, aceclofenac is still a little bit safer for the heart patient, but still there is a risk of cardiac events because diclofenac and aceclofenac, they are almost similar drugs. Now aceclofenac, they both are similar over here, and for the GI tolerance, the aceclofenac is a little bit more tolerable than the diclofenac, right? So we were on aceclofenac. Because of all those action, we can use a PPI, though the risk is not that huge, but still for safer side we can use a PPI for aceclofenac, which is the lansoprazole. Again, similar to the NSAID, we give this lansoprazole once a day. Everybody will see this thing, once a day stuff, once a day over here, once a day in indomethacin. Everywhere, literally everywhere, whenever we give a NSAID, we give a PPI alongside with it. 1 PPI once a day, that to before meal. So for aceclofenac, it's lansoprazole. So next time, whenever you prescribe aceclofenac, do prescribe lansoprazole alongside with it. And next, some other time, I'll try to make a video in which I'll write down all the NSAIDs and particular PPI for it. Right, now finally for indication. Indication is completely similar to that of diclofenac, which is arthritis and musculoskeletal pain. Right, it is literally similar to that of diclofenac over here. Right, and lastly for the combination, we have already discussed about the 2 tablets which are available in the market, 100 mg and 200 mg tablets. If you are giving 200 milligram tablet, only give once. If you have 2 milligram tablets, you have authority to give till about 2 milligrams. Well, authority? Let it be. Next is the combination that you can give alongside with the aceclofenac. Aceclofenac plus paracetamol. You can use aceclofenac with ceratopeptidase. You can use aceclofenac with trypsin, chymotrypsin. Now, why we give certain combination? Paracetamol will help us to cover the antipyretic effect of aceclofenac because aceclofenac was lacking antipyretic effect, right? Aceclofenac, ceratopeptidase, and aceclofenac, trypsin, chymotrypsin, in both this combination, it actually helps us to decrease the overall amount of aceclofenac used by us, and at the same time we use some other drug that will take the role of that anti-inflammatory property that aceclofenac actually had. So in both the condition, you can use this combination if you suspect a high level of trauma and a high level of inflammation present in the body. So this was all about aceclofenac.